Shelby Brayland. I'm going to be doing IV push with Verapamil. My physician orders here are for Verapamil, and I have an 82-year-old gentleman that I'm going to be doing it on. His name's Pat Smith, and I have gotten my orders. I have looked through everything with my drug book. I did all that and all the calculations. I did the first 5 rights, you know, the right dosage, the right route, the right patient, the right amount, the right time, and when I'm completely finished and have done that for the 3rd time, I will do the right documentation also. But I have looked at this 5 milligrams IV push order for this patient and gone through my book, done all my calculations, looked for the allergies. This patient is allergic to morphine, and this patient also has D5 half normal saline running, and that is, the Verapamil is not compatible with that. So I know that right now. Since he's an elderly patient, I need to give it over 3 minutes, the IV push. So I'm going to also be drawing up some normal saline to be able to dilute it, and so that'll be easier for me to give it over the 3 minutes. And so I've done all that. I have washed my hands. I've come into the room, and I've identified my patient with 2 patient identifiers. I've looked at his wristband, and I've also asked him his birth date, which he stated back to me, and explained what I'm going to be coming in to do, that I'm going to be coming in to give him some Verapamil IV push. And now I'm going to once again go through my 5 rights just to make sure I've got everything that I need, and I have it all here. I'm going to go ahead and draw up my Verapamil, and I've cleaned this off before I've done this. And I've already pre-gotten my 1 milliliter of normal saline, so I'm going to go ahead. I'm going to draw back first so I have some room to put my drug in there. And just make sure I get it all in there. This is going to go in the sharps container. I would not be recapping. For practice purposes, I'm going to recap it. And then I'm going to make sure I get all the air out. Okay. Now this would of course have a cap on it, but I don't have one. So then I'm going to go ahead, and I know that this drug is not compatible. When I did my 5 rights, I know it's not compatible with this. So I'm going to go ahead and stop the infusion. I'm going to go ahead and clamp so it's not running, and I've found the port closest to the patient. I'm going to go ahead. I've explained this procedure to the patient so they know what I'm doing. I'm going to go ahead and scrub the hub for 15 seconds at least, not only the sides but also the top. Okay, so now I've got that done. I'm going to take my normal saline, and I'm going to go ahead and I'm going to flush this line so that I get that medication out. I'm going to go ahead and flush 2 to 3 mils, and I'm actually not going to do it right now because I don't know if it's going to go on the floor because it's not hooked up. So, but I would flush 2 to 3 mils, take it off, make sure I keep this so that it's still clean and ready for the medication. Got the medication on, and now over 3 minutes I have a 1.5 milliliters in here, and over that 3 minutes I'm going to put in 0.5 milliliters over a minute. So when I'm done doing that over the 3 minutes, take it off. I'm going to go ahead and put my normal saline flush on there again, and over 3 minutes I'm going to deliver 1 milliliter per minute at the same rate that I delivered the Verapamil. So I've done that, taken it off. I'm going to go ahead and start my machine up again after I've unclamp it and then start it up. And I'm going to check my patient and make sure that they are comfortable, and ask, while I'm giving it, I'm going to ask if they're feeling, how they're, I'm just going to be assessing them, I guess, and making sure that they're tolerating that medication well. And I'm going to make sure that I clean all my stuff up, and that is it. I'll come back in half an hour and assess the patient, and if they need more medication, I will give it again.